Okay. Here we have an ulcer, one of our patients who's approximately 75 years old. And the lesion measures out at about 1.5 by 2. Okay, as you can see, you see this little white around the edges, but it's nice and pink here. And this has really improved a lot since we started. And all we want to do is clean off a little bit of the slough on her and see we getting good bleeding, and that's what we want to see. It's a little tender for her, but this is how we know it's healing well. We use a enzymatic debridement on her called Santel, because for a while it had a lot of what they call necrotic tissue over top. Now it's nice and pink, and we just have to take off a little bit of the slough that may develop. But her ulcer is healing well, and it's been about 2 months. So this is what we do. We just basically lightly stimulate that tissue, clean off some of that slough. We then get a wound cleanser spray, and we spray it. We don't need, and sometimes we'll take a culture, but she's basically still on the same antibiotics. We won't culture it today, but the next time we come back, we may culture it. But it's advanced, it's coming along really good. The tissues look pink and nice. So that's the end. That's basically the debridement that we do. We're gonna cover it with the Santel. We're gonna put a sterile gauze on top of it, which is 2x2. And we also try to keep the pressure off. She had a special boot that she was wearing. A special boot that she was wearing. So we're gonna put a gauze over it. We're gonna also try to keep the pressure off, and we use a special padding to go on top of that gauze. Can you get the Santel? The Santel, the ointment.
And did you cut her nails? Her fingernails?
Okay. You're supposed to do them actually, but we'll do them today to help you out.
Because they extra long, they edgy and all that.
Okay. So we kind of do this to keep the pressure off, and that helps when it's in there. And that keeps the pressure off. And then we'll put the sterile gauze on top with her medicine and tape it. Okay? And that's it.